Next topic that I want to talk about is concussions, because this episode is airing on Super Bowl Sunday. And, besides the whole Deflategate scandal going on with the Patriots and the NFL and all of that, concussions have been a really important controversial issue. And, there's still a lot that we're learning, but so far the scientific evidence is very concerning for the consequences of CTE, that is chronic traumatic encephalopathy. It causes emotional problems, damage to decision-making abilities, and, lots and lots of other consequences that our athletes are suffering through. And it's not just the NFL. We're seeing this in the National Hockey League. We're seeing this in the NCAA, and even in the WWE, the wrestlers. All of them are starting to pay more and more attention to concussions. And there's still a lot of information that we need to learn about. There's still a lot of questions to be asked. And I'm really hoping that advocates and journalists will keep up their efforts to get to the bottom of the truth. But for this segment of the program, what I'd like to do is help athletes and parents of athletes, get with some news that they can use. And, how do we know if an athlete in our lives has a concussion? What can we do about it? And how can we advocate in our communities for safer sports? So to help us answer some of these questions, we have Dr. Moin Sala, who is going to be joining us. He is a board-certified physician specializing in sports medicine in Southern California. And since graduating from medical school and training in the field of sports medicine, Dr. Sala has been the head team physician for the USA Olympic BMX men and women teams. He has also been the head team physician for Mountain Dew Action's sports tour, the powerhouse of Gardena Sierra High School football, and he is a veteran on-course physician for the Hawaii Ironman World Championships. During his training at UCLA and other surrounding facilities, Dr. Sala focused his attention on the growing epidemic of head injuries, including concussions. So, Dr. Sala, thank you so much for coming on the show. We really appreciate it.
Sanjeev, thank you so much for having me on the show. The timing of our chat on concussions is fairly fortuitous, especially since it is Super Bowl week. And while the topic of concussions has been more in the spotlight recently over the past few years, it hasn't always been that way. So just to take you back, just a decade ago, head injuries were an afterthought. Back then and even before then, when an athlete would have a head injury, they were just thought to have had their bell rung or their, quote, cobwebs knocked loose.
Right, and that was considered kind of a coming of age, and, that was sort of a kind of way of getting hair on your chest as an athlete, right?
Exactly. The thinking was that, real athletes push through these injuries to show their true grit, that these head injuries would build you up and make you outlast further punishment. It got so crazy that some people, that was actually like 40% of Americans 10 years ago thought that, another hit to the head while you're having an active concussion or head injury would actually help you recover faster from the first hit, like Wile E. Coyote cartoon.
Oh, wow. So, but it sounds like we're learning a lot more about concussions, and I know that some of our listeners are athletes, and some of them are the parents of athletes at different ages. So, when should we suspect a concussion has happened in an adult versus a child? And, not to make things more complicated, because I understand there are different levels of concussions, but how do we identify what level we're looking at when we are, trying to protect the athletes in our lives?
Those are great questions. I think the first thing we got to figure out and understand is, what is a concussion?
Mm-hmm.
So scientifically, there are head injuries that can be from direct or indirect contact to the head. It basically causes the brain to shake violently, bouncing around inside the skull. Essentially, it bruises the brain. The technical term that it's known as is mild traumatic brain injuries. So concussion is a mild traumatic brain injury. When you hear that term, that scientific term, hopefully it sheds a little more light on the seriousness of the injuries. That jarring effect on the brain interrupts and impairs a lot of the normal brain functions. So athletes typically will have, changes in their thinking, their equilibrium and balance, even their consciousness. So, it's not just thinking about just athletes as well. Sometimes it can happen to anyone. If you're in a car accident, if you fall and hit your head, and sometimes it's not just football as well. Everyone talks about football being the kind of the only place where concussions can come from, but women's soccer is notoriously high. Wrestling, kind of like how you mentioned the other sports as well. So, now that we've kind of defined what a concussion is, typically when a concussion happens, most athletes have headaches, nausea, fogginess, kind of dizziness. They may feel like they're a little sensitive to light and sound. They usually don't feel themselves. It's tough to concentrate. They sometimes feel depressed. Those are tough things to see because they're not, they're very subjective.
Mm-hmm.
If the athlete lost consciousness, that pretty much guarantees a concussion. But the majority of the time, they don't lose consciousness. So when do we suspect the concussion, just like between adults and children? Well, as a team doc, my focus is usually looking at the athlete's body when I'm on the sideline. So I'm always focusing on their body and especially their head. Did they get helmet-to-helmet contact in football? Did their head snap back? Did they get an elbow to the head while going for a ball in soccer? Or were they snowboarding and did they fall and catch an edge and have their body and head recoil off the ground? That kind of gives me my initial information. Hey, I need to look out for this athlete. I need to check them out on the sidelines. The symptoms between the adults and children are similar, but it's tougher to get a diagnosis, especially with children. First, you're dealing with a historian and a kid that may not understand what's going on.
Mm-hmm.
They're maybe afraid to let their trainer, coach know that they have something going on, and maybe their thought process is that they got to push through it, and that's what will make them a tough athlete, and that's what their parents did, so that's what they need to do. So it really takes a team approach, especially with children. You're focusing on, talking with the trainer, talking with the coach, talking with the parents. The parents know the child better than anyone. Are they acting normally? Do they seem like they're having trouble focusing? On the sideline and in the clinic, what we do is we try to evaluate both the adults and children with certain tests. First, we kind of check their, state neurologically. So, I'll use my pen light and shine it in their eyes and see how their pupils react. I'll check a couple other nerves in their face and make sure they're working appropriately. I'll make sure they don't have neck pain because a big problem with head injuries is we make sure the neck's okay. And then we can actually use, a couple questions to kind of check to see kind of how their brain is functioning. We can check their knowledge by asking them their name, where they are, what happened on the play in question, who the President of the United States is, simple knowledge that everyone should know.
Mm-hmm.
We try to test their memory, so I give them a few things to remember, and I'll ask them later, what were the 3 words I told you? And then I ask them about simple math things, like, hey, count backwards from 100 by 5s, or can you spell the word world?
Mm-hmm. Mm-hmm.
So if they're struggling in these, things, it continues to up my suspicion. Is this a true concussion? And again, the trainer, the coach, especially the parent will know, hey, my kid's not acting right. They normally know this stuff. As concussions have kind of come into the mainstream, the big deal that we're noticing is that we're really focusing on concussions in children because they are more serious. Just as you've said, their brains are still developing. They take longer to recover because of that. And then there's the worry about cumulative head injuries and their impact as you get older.
Right.
So
that actually kind of leads me to kind of the next question about, so, how would we, because, we want to make sure that, we're not putting kids, and other athletes at risk for the next concussion or a new, traumatic brain injury by putting them back into sports too soon. So how do we know when it's safe to go back to playing a sport? And, what happens if you do get sent back into play too soon?
When we think about concussions, the treatment is universal. It's brain rest. And kind of sounds easy. Hey, you need to rest your brain, but it's really tougher than it sounds like. It means limiting or avoiding, if that's possible, all television, computers, smartphones, podcasts, video games, music, even homework while your brain heals. And it also means avoiding exercise. All of these things I mentioned activate the brain and delay healing. And, I try to relate to my athletes, especially the kids. Your brain is bruised. It's like your knee being bruised. If you smash your knee against something and it's hurting, and you try to run and exercise, do you think it's going to take longer for your knee to heal?
Mm-hmm.
And they realize and they nod. And I said, that's the same thing happening with your brain. You really need to give it the time to let it heal on its own. So, what I do is we make sure that we closely monitor the athletes, that they're improving slowly, that, along with the brain rest, they're not having any worsening of symptoms. And some of the things we look out for are they vomiting? Has their mental status changed? Have they had a seizure? Those are very worrisome symptoms. Maybe they need some head imaging at that point. But typically most people don't have those type of symptoms. So once they're fully asymptomatic, so they got no headache left, they've been great for at least 3 or more consecutive days, I usually advocate doing a stress test on them. A stress test is as simple as having them jog in place and doing jumping jacks and push-ups and sit-ups, or riding a stationary bike. What I'm trying to do is increase their heart rate, try to kind of stress the brain, and see if they redevelop any of those concussion symptoms again. If they do fine, don't have any symptoms with that simple 10, 15-minute test, then I usually clear them to get back to their sport, but it's on a gradual return to play. So now that they've been asymptomatic, they passed my little stress test, I say, okay, you can clear. You're cleared for practice, but the first thing is I'm only going to put you in non-contact, and I'm only going to let you do drills initially. So the trainer's going to keep a closer eye on them. They're going to see how they do that first day. If they have no symptoms, they'll maybe get it back into some scrimmaging, but no contact. And then if they do well with that, I'll get them back to contact practice. And then the last step is I'll clear them for play. But if at any point along that little pathway they feel symptoms again, they go back to the start. You do not pass go. You do not collect 200. So the second thing that you asked about is what happens if you haven't fully healed from your first concussion and you potentially get hit again. Mm-hmm. So that's extremely worrisome. There's a syndrome out there. It's called second impact syndrome. And when the brain hasn't fully healed from the first injury or the first concussion, it's extremely susceptible to an even far worse injury with even a little, less stimuli. So just a little bump to the head when you have a concussion could cause a worse concussion or this second impact syndrome. That is caused from severe brain swelling, and when the brain swells like that, it's usually fatal. Kids who do survive usually have significant delays, and I've actually sadly seen this firsthand. I did a rotation at a pediatric emergency room during residency, and I had a previously healthy 10-year-old who came into the ER with seizures, and I spoke with the mom. Kid was totally normal, was playing Pop Warner football, had a head injury, turns out to be a concussion, didn't tell anyone, didn't really know, went back in, played the next week, had another head injury, immediately started having seizures, has suffered from daily seizures since, and then suffers from mental retardation. So I've seen it firsthand, and it's scary. But now at least things are more out in the public, and people are getting educated about it.
Yeah. So, and that actually leads into kind of the next thing I wanted to talk to you about, is that, what can families do, to keep, their young athletes safe, and, are there ages that are just too young for certain sports? I mean, because you're a dad, and, so, what's your approach, knowing what you know and seeing what you've seen?
Yeah, those are good questions as well. The most important thing I tell my parents to consider, my athletes to consider, are you ready for that sport? Is your child ready for that sport? Do you feel like they can, like for football, can they learn those proper tackling techniques and not lead with their head when they try to tackle? Do they have that body control? Most people would say it doesn't make sense for anyone who's not up into high school, so 13 and younger, to try tackle football. But Pop Warner's there. Does it make sense for them to be exposed so early to potentially violent sport? It's interesting now, like Pop Warner football participation has dropped off significantly. So just in the past 5 years, it's dropped 30%. Most parents don't want to expose their kids to these repetitive head hits. Mm-hmm. And they've seen that, you don't necessarily need to put your kid in one sport all year round to make them good and potentially better for the future, get them that college scholarship, multiple sports, build them up. I was reading that, in Pop Warner, they estimate the head impacts during each season at about 200 to 500 hits or head impacts throughout the season. Wow. And these kids start when they're 6, 7, 8 years old, play up till high school, and then play into high school. Even LeBron James in the last few weeks, people asked him, he has 2 sons like I do. Mm-hmm. And they said, what would you let your kids play? And he's like, basketball, baseball. I'll let them swim and run track. What about football? No, I won't let them play because of concussions, because of the aftermath. Huh. So I have 2 sons, 5 years old and 3 years old. We do watch a lot of football, but I also realize that, that I'm very fortunate to say that, my sons won't ever play Pop Warner. They won't play tackle football. If they want to play flag football or two-hand catch, I'm probably fine with that. And I'll wholeheartedly support any of their other athletic pursuits. But having seen so many injuries close up, it's not worth it. So really, it comes down to a few things. Do you think your child's ready for that sport? Physically, mentally? Can they learn those right tackling techniques, especially in football? Does it make sense for, athletes in soccer to head the ball? As a young athlete in soccer through AYSO, into high school, college, club, the repetitive head hits add up. Does that lead to that chronic traumatic encephalopathy? Right. So these are all things that we have to, be concerned about, aware about, and hopefully we can make informed decisions.
I really appreciate this candor, and also just because you're able to speak from both being a parent and and a physician. I've got one last question for you, and it's not an easy one because we don't really have too much time left. But I did want to kind of get your take on this because it does involve, I think, some parents actually kind of trying to make some policy happen on their at their local government level. So last week, the New York City Council started going over some legislation that would require a doctor or an athletic trainer to be present at all organized youth football games for all full contact practices. And they are also, the legislation has in it a task force. They're going to build a task force to collect data on all concussions to guide future safety recommendations. Advocates are saying that this is the first proposed legislation of its kind, and the trainer for the Pittsburgh Steelers actually testified to the New York City Council that he thought it was important to pass this law. But others are pointing out that the cost of having a doctor on the field is going to make it really tough to fund youth sports in poor communities. So it sounds like the City Council is kind of stuck between safety and cost. What do you think, Dr. Sala?
It raises an interesting dilemma. As a sports medicine physician and as just a sports fan in general, when I'm on the sidelines of, my high school team that I cover, I'm a volunteer physician. When I trained through one of the UCLA sports medicine programs, I was blessed to be a part of this program here in Los Angeles. It was called the West Coast Sports Medicine Foundation, and they had a Team to Win program. And what they did for 22 local high schools, they would provide athletic trainers, physicians who would volunteer their time on the sidelines and in a Saturday injury clinic to, provide coverage and educate athletes and diagnose and treat them. So I was exposed to a lot of young athletes, and the cost was practically nil. So I think, does it make sense to have physician, medical, athletic trainer coverage on the sidelines of any youth football game or any football game? I wholeheartedly agree. So I think the cost would be minimal because most physicians would want to be out there. If you're a sports medicine physician, most of us love sports. We especially love kids playing sports. We want to look after them and keep a close eye on them and make sure that we can try to prevent future problems from happening. Again, some of the things that we need to look at are, does it make sense for kids, younger than 12 or 13 to be tackling, to lead with their head, to have so many repetitive head impacts? And it's tough to change that kind of sports center mentality that our society has, where all the biggest hits are glamorized and, the routine hits aren't. So, I think it's something that if we give it time, it'll kind of tease itself out further. This is another big step for us. And hopefully, just as there's more awareness and education, people can make better informed decisions. But I would definitely support having physicians, athletic trainers on the sidelines of all football games and see how they do.
Awesome. Well, Dr. Saleh, thank you so much for joining us. I know that we ran out of time a little bit today, and we're definitely going to have you back to guide our families, because I think that you gave us a lot of food for thought. Really appreciate your insights. Thank you so much for joining us on the program.
Yeah, I appreciate you guys, and thank you so much, Sanjeev.